Um, so I am in the business of ending homelessness. It's what I do, it's what I've been working on for the last 5 years, and it's everything I eat, breathe, and sleep, ending homelessness. So you are going to hear that. So I'm also going to say from the very beginning that I believe housing is healthcare, that we cannot do healthcare without housing. So the question that we asked communities all over this country is, are you ready for zero? Are you willing to do everything it takes to get to zero homelessness by the end of next year for veterans? And by the end of 2016, will you end will you end homelessness for people who are chronically homeless? And that's what we're working on. We were at Community Solutions, the 100,000 Homes campaign. We worked with 182 communities around the country to end homelessness for over 100,000 people. We did that in a 4-year period. And we were part of a country, a national movement that has reduced veteran homelessness by 33% and reduced long-term homelessness by 20%. So it's been a really exciting time in this country to be part of ending homelessness. That's a group of people who went out in San Diego at 4 o'clock in the morning to talk to homeless people. So who we are today is zero. We are no longer satisfied with reducing homelessness. We are going to take that to functional zero, and I can explain that later. I'm not going to go into that detail. But what stays the same for us as we're doing this work is Ed Givens. Ed lived on the streets of Skid Row for 30 years drinking. And Ed will tell you, I was a mean, ugly drunk. We surveyed every homeless person on Skid Row who would talk to us and prioritized those who had the highest risk of dying. Ed made it to the top of the list, and when he got to the top of the list, the prioritized list, he was offered an apartment and he took it. He moved into housing still drunk. Once he got into housing and his case manager was there and talking with him, he said to him, "What can I do to help you?" And Ed said, "You know, actually, I'd like to quit drinking." So he did, and there's Ed. So that's what this is about. In the beginning, we talked about reducing your homelessness by 2.5% every month. But now we're talking about a commitment to end veteran and chronic homelessness. We did it by helping people build a local team, clarify their demand with a really good instrument for triaging, put your housing lined up with your triaging, and move people in using a housing first model. So once we developed that, we spread it all over the country. But now we either have to scale that up or we should just leave. No pun intended, go home. But so this is what we learned. Find an idea and start. That's our prototype. We started in Times Square, where Common Ground had a building right on Times Square, very affordable, low barrier, and 100 people living on Times Square. And we said, what's wrong? And we developed a program to connect with people on Times Square, and that was Times Square afterwards. We said, okay, we got a good idea here on what we can do. So we said, let's take that idea, let's take it other places, let's learn from everybody's screw up, and then let's change and make that happen. That's what we call piloting. Charlotte, Denver, Washington, D.C., Los Angeles, and others tried it out. We did not duplicate what we did on Times Square. We took what we learned. We said, this is what we're learning. This is what we think is important. You try it, and let's figure it out, and let's measure our outcomes. After that, we said, we're going to take those things we learned from the Vanguard communities, we are going to spread them around the country, and we did that with the 100,000 Homes campaign by going after communities that had more than 1,000 people homeless on their streets, and anybody else who wanted to join us. It was a very low barrier campaign. Anybody who wanted to could be part of this. We spread it to over 200 communities. And now, those are the communities that were part of this. And now, we're going to take it to scale. We're going to help communities get to zero homelessness among veterans and also among people who are long-term homeless. So that's what we've been doing. And that's our try it, figure it out, spread it around, and then scale it up. That's what we've been doing. This, I understand, is Lean Startup. I didn't really know that, but somebody told me that. So the question for communities, are you ready for zero? And there are some things that we learned in doing these campaigns that I want to share with you. Choose a kick-ass leader. You have to have someone who can actually lead what you're doing. Becky Canis, who led the 100,000 Homes campaign, is a once-in-a-generation leader. Put together the best team possible. Every one of the people you see there was part of the 100,000 Homes campaign, was all about making sure that in our genius, we worked and we did amazing stuff. We dreamed and planned every 6 months. Those 10-year plans to end homelessness, they're worth the paper you print them on, or maybe not. We planned every 6 months, and we drew it up, and we figured out what we were doing, and at the end of 6 months, we said, have we done it? And let the data nerds lead the strategy. It was Paul Howard who said to us, the guy right there, said to us, we're going to be the 30,000 Homes campaign unless we change everything. And that would have been embarrassing since we'd said we were the 100,000 Homes campaign. And the question we ask communities is, are you ready for zero? We've set higher standards for communities to be part of this, and we've invited them to work with us. 71 communities, including 4 states, are part of zero in 2016 because we now know what it takes to make this work. We've spread it around, and we're about taking it to scale. Thank you.